And between the three of you, have you seen any particular groups that have been more at risk for food allergies? I'll add that eczema and genetics are common things shown for peanut, egg, etc. But what have you seen in your practices?
Yeah, I can talk a little bit to that. So 100% agree. Like you think about the atopic triad. So a lot of times if families are coming in with eczema, allergies, asthma, like you said, taking a further history and seeing if there's any family history or personal history of that. Also, being in a rural coastal community, we see a lot of disparities around education. And we all know that the LEAP study was very crucial in changing the landscape of food allergies. But we're also seeing that not all of the families have heard about the clinical recommendations from the LEAP study. And some people are still hearing kind of like the old school, you wait until a year. And so we're really trying to make sure that that education that families are receiving is equitable and that they all know that, early food introduction, 4 to 6 months of age, thinking about those high risk food allergens, that kind of thing, that we're all on the same page about that so that everyone has the best chance at preventing further food allergies down the line. So I think that's the biggest thing that I've seen has just been the disparity between education, and that can actually, if everyone doesn't have the same access to resources and education, can really affect their risk of food allergies down the line. And then we also see, at least within a lot of rural communities in Mississippi, that Black and brown families a lot of times are the ones that end up in the ER or who have a more severe food allergy for many different reasons. And I think that's one of those, that's why social determinants are so important, right? Because we have a chance to really modify a lot of that and prevent that from happening. So from my perspective, that's what I've seen as far as, people who are a little bit more at risk and where we can come into the picture as healthcare providers and preventing that from happening.
Yeah. Off of that, in my clinical practice as well, I've noticed that patients who have like multiple food allergies, like it was just mentioned, I think it can be particularly challenging because these patients definitely require a little more attention to detail when it comes to their dietary management and education, so that we can make sure even the slightest of accidental exposures can be avoided, and another thing in my practice, especially because I also deal in clinical nutrition, I think patients with food allergies and asthma, I think they have a higher risk of severe allergic reactions. So I think I pay attention to coordinating approach to treat and monitor both these conditions with a thorough balance. And even in cases where if a patient has been newly diagnosed with a food allergy, I think although it's less common, sometimes adults then later on tend to develop food allergies. So these, like I've seen a patient recently with a very severe anaphylactic reaction. So I think I try to take a lot of extra care in those cases. So yeah, from my clinical experience, that's what I felt off of what has been just said.